Okay, so my topic is a dichloroacetate for cancer care. It has been investigated as a novel metabolic therapy for various cancers since 2007. What they found that this Canadian study, they found this drug will help to block the abnormal metabolic process. And because the cell during the cancer is not differentiated or in a correct path, so it could be undifferentiated, well differentiated, or high differentiated. So they find this drug will help the cells to proliferate in a correct path and a correct metabolic process. And then I'll explain what does this drug approved by the FDA, what's a Warburg effect, and what's a clinical trials of this drug, and what's a side effect of this drug. So let's get started, and I'll explain more and more about dichloroacetate cancer care. Okay, on here I'm going to explain the scientific name of the dichloroacetate. So dichloroacetate is a salt which is a sodium chloride of dichloroacetic acid. DCA it's a byproduct of the chlorine disfaction of water. Ca is just a powder that can made into the pill forms. And here I just show you guys the two chloride with the hydroxide and one oxygen. And this is just a scientific name of the dichloroacetate drug. Okay, on here I will explain the purpose of the dichloroacetate in cancers and how can make impact. So DCA in cancer therapy comes from metabolic properties of cancer cells, increase the glycolytic activities, reduce the mitochondrial oxidations, and all of that it's during the aerobic aspiration, not anaerobic, which is when the oxygen was occur, not absence. So I'll explain how can this drug make impact, because during the cancer cells, the mitochondria will not produce enough ATP. Instead of 36 ATP, sometimes only 2 ATP. So this drug will help to make the cells proliferating in a correct way for metabolic process. Okay, so the DCA cancer treatment, which is this, as I said, this chemical have the ability to block the abnormal metabolic process and reactivate non-functional mitochondria that is not able to produce ATP in many cancer cells. And it's called Warburg, which is Warburg effect, which is this is considered to be cancer cells, and during the aerobic glycolysis. And I'll explain how can this drug make impact to make the cells to proliferating in a correct path of metabolic process, and how can the Warburg block the mitochondria when producing the ATP. I'll explain that in the next slide too. Okay, on here I'll explain the normal cells in absence of oxygen. So here there is no oxygen in these cells, and then I'll explain the metabolic process. So by that we will understand how much this drug can make impact in different kind of cancer such as brain, lung, and etc. So let's get started. So this cells imagine it does get glucose. In absence of oxygen, after getting glucose, the glycolysis will take place in the cytoplasm, and then we'll go to the pyruvate. And then just because there is no oxygen on the cells, so it will not go to the mitochondria, will go directly to the lactate. And then when go to the lactate, we'll just produce 2 ATP per glucose. And then the next slide will explain more and more what do I mean, why I explain the normal cells, and why I will explain the Warburg effect. On here, I will explain when the cells has an oxygen. Comparing the other one, the cell doesn't have an oxygen. So this is oxidative phosphorylations, which is the cells is oxygen rich. And then when the cells get the glucose, it's the same thing as we said in the previous slide, which is the glycolysis will take place in the cytoplasm and then go to the pyruvate. And then when go to the pyruvate, the cells because this cell is already has oxygen rich, so it does have a mitochondria. So the mitochondria will be possible to generate 36 ATP per glucose. So on the next slide, I will explain how can be the pyruvate is not going to the mitochondria. It's a block, and it's go to the lactate. That's why it's not producing oxygen. That's why it's not producing ATP during the metabolic process. Okay, on here, I'm going to explain about the cancer cells, which is the aerobic glycolysis, but during the cancer cells. So why this is will make more sense to explain or to illustrate how much this drug important to make the cells to proliferating, and why we said this drug will help to block the abnormal metabolic process. So as we said, this cell is already oxygen rich, but this one is different comparing to the previous slides just because this is cancer cells. So I'll explain how can the cancer cells be different. So this cells, it does take glucose, and then cytoplasm will take place after getting glucose and go to the pyruvate. And then from the pyruvate, just because this cell, it does have oxygen, so it does have a mitochondria on the cells. So just this because it's cancer, which is Warburg effect, it's a block. So instead of go to the mitochondria to produce the 36 ATP, same as the previous slide, which is for normal cells, on here is not. It's go jump directly to the lactate to the cell that it doesn't have oxygen, and then produce only 2 ATP. So by that can produce cancer cells and could be metastasized to the other organ in the body. But by having the DCA will help to make the cells to proliferate or go to the correct metabolic process, look like the previous slide, how can be jump from pyruvate and then go directly to the mitochondria to produce an oxygen and to produce 36 ATP. Okay, so on here I explained the DCA anti-cancer activities. So it could be lung cell carcinoid, breast cancer, neuroblastoma, prostate cancer, multiple myeloma, kidney cancer, endometrial cancer, and it's also some clinical trials for non-Hodgkin lymphoma. So what they did, they used the drug plus they use with the drug they use a different kind of treatment such as radiation therapy or chemotherapy, and by that they are able to treat the non-Hodgkin lymphoma. We explain how much is important and how this drug and how much can make impact, but also does have a side effect. So the side effect of this drug can cause a nerve damage, which is peripheral neuropathy. And then they find during the clinical trials, some patient they have a numbness, paresthesia, gait disturbance. That's why I think the FDA still not approved this drug yet. Just because there is some kind of side effect, it's happened with some patient too. Okay, on this slide, it's according to the Environmental Protection Agency, which is the EPA. So they found two studies research. They found that DCA may decrease the immune response against the cancer by altering the activities of the T lymphocytes. But on the other hand, they find another research that the DCA could increase the immune function in the tumor by reducing the lactic acid levels in the tumor environment. That's why they still work in the clinical trials, but I think after finishing all the clinical trials of this drug will make a huge impact for cure the cancers. It's not only treat, but just because the FDA still not prove it because of amount of the side effect, and they still not finishing all the clinical trials for this drug. Okay, so I did some research about the clinical trials. So I went to the clinical trial website and I took one of the clinical trials that they did, which was in phase 2 study of DCA, dichloroacetate. So it was combination between the DCA and other kind of treatments such as radiation therapy, cytoplastin, and other kind for stage 2 and stage 4 squamous cell carcinoma of head and neck. So what they did, they used I grabbed for both the intravasation treatment or the arm, they used the same thing, was the DCA orally 12.5 milligram, PO per G2 BID daily for 8 weeks, and it's the same thing with the arm. But what did I find in this website was really interesting. So they did only six clinical trials, and it's only 4 complete. One was determined and one was withdrawn, so still working on it. So what did I see in the clinical trial website? It's give me an explanation that this drug is still under processing. Some special hospital they already able to give to patients, but the FDA is still not to prove this drug yet. Okay, so this is my last slide. So on here, I just want to explain that the U.S. Food and Drug Administration approval, they didn't approve the DCA, just because it's still under clinical trials, and then there is no evidence that the DCA can make impact to fight against cancer. So the FDA is still not approved. Even when I went to the clinical trial, as I said in the previous slide, it was only 4 drugs was complete and 2 was determined, and there's only one that does have the result. The rest it doesn't have even result in the website. So what did explain today? We did explain how can this drug make impact. What's the scientific name of this drug? What's a side effect of this drug? Or what's a Warburg effect? What's a normal cells? Why we have this drug? What's a study of this drug? And that's it.